Gastrointestinal diseases affect many, many people in this country and all around the world. New York Presbyterian is determined, as good as our program is today, to make it even better going forward.
We want our patients to feel that when they come to us, we're going to do everything we can to take care of their problem. We're going to have the latest techniques, the most innovative techniques, and we're going to be the most humane, compassionate institution that we can possibly be.
I think it's critical for the New York metropolitan area to have one institution that has best-in-class healthcare services in every clinical discipline.
The hospital does put its patients first. It's absolutely believed in and followed, and the medical personnel at the hospital all believe that themselves.
When I was diagnosed with Crohn's, actually when it happened, my intestines perforated, so it was all quite urgent at that point. 4 months or so later, Dr. Stephen Hanauer introduced me to Dr. Michelasi. He had a successful procedure with me and everything went great.
And then, there is about a 10% familiarity in patients with inflammatory bowel disease.
Then in 2009, our daughter Abby started to have some symptoms.
When we got to New York Presbyterian, it was easier to see them working right away to fix it. And instead of just sitting back and saying, you have Crohn's disease, this is what it is, this is what it's going to be, it was more of a proactive approach.
First of all, we hope that you never have to get to the surgery stage. Given the fact that it was necessary, especially for Abby, to have surgery, there was no doubt in our mind or question who we wanted to go with. And we knew Dr. Michelasi was here, we went straight to him.
Abigail had minimally invasive surgery, and 3 weeks later she was playing basketball again.
The team at New York Presbyterian, now with 3 children that have Crohn's disease and a husband, knowing that they're there for me, there's no reason for us to really be up at night worrying.
The comfort thing is that we know they're there if we need them.
My dad did the same thing that I feel like I'm doing for my sisters. It's definitely important to me to be a role model to them and show that I can still live my life as a normal kid.
Right now we're trying to find a way to completely change the approach to taking care of patients with intestinal problems.
We have joint conferences with our pathologists, our surgeons on a weekly basis, at which we regularly review those patients who need the kind of multidisciplinary care that is so often required in this specialty.
We intend to be right there at the forefront of innovating new ideas, new concepts, new medicines, new therapies for our patients.
With the quality of surgeons that we have here, with the quality of physicians that we have here, with the support of the hospital, and with the support of our friends, these things will happen here first.